Don Nystrom, and I have a really interesting program for you today, and I hope that you stay tuned and listen to what we have to say. We're going to be talking about the Norwood Health Center, which is just past Culver's on the way up to McMillan, and it's an interesting building with multiple county offices. So I have two guests here. One of them is Brandon Brewink, who is the Director of Human Services for Wood County, and also Jordan Bruce, who is the Administrator of the Health Center, Norwood. But let's talk with Brandon first. The Norwood at one time was exclusively, I believe, mental health, but it's changed. The building itself has changed in occupancy. Tell me about that.
Sure. So a few years ago, the county board made a decision that they wanted to change what we knew as Norwood Health Center into a county building. So we had a number of departments that were located actually in this building, the former City Hall, that moved over to the Wood County Annex and Health Center, what we all know as Norwood Health Center. Mm-hmm. So the Sheriff's Department moved and now has an office within the building. The Health Department also has an office within the building. We also have staff that provide services for outpatient therapy within the building, and also Birth to 3 has services in the building as well. We also have...
Excuse me, what is Birth to 3? I'm not familiar with that.
Birth to 3 is one of our community programs that works with kids primarily from their birth to age 3 that need a little extra help when they're getting started. So might be a child that has some needs, maybe isn't growing as fast as other children,
I see.
Those sort of things.
Okay, and is that run by Human Services or by...
Yeah, it's a human services function. So we have staff that are located in Wisconsin Rapids as well. And that's just
that's interesting.
A nice office space for us.
Keep going.
So that primarily consists of the folks. Oh, I'm sorry. We also have veteran services that occupies a space in our building as well. So they provide services on the north end of the county, and we also have our veterans office in the courthouse too.
Okay. We'll talk to you a bit later, but you also have some employees of Human Services in this particular building yet, do you?
We do, yeah.
And this is the tall building on Central Avenue, formerly known as City Hall.
Yes. So yeah, we do have staff that occupy the 4th floor here. And our plan is long-term, actually beginning in November, to have staff move from our Cornerstone location, which is on 4th Street here in Marshfield, to occupy the 2nd floor here.
Okay. They're going to occupy the 2nd floor
in this building, yeah,
on a leased basis.
Yep.
Oh, cool. All right. Well, let's start more discussion on the Norwood Health Center, which is both a hospital, a certified hospital, and a mental health center, right?
Correct.
Okay. What's the distinction? What kind of it's not a hospital, doesn't have an emergency room. It's not like the medical center down the road.
Right. So thanks for having us here today to talk about this. So at Norwood Health Center, we have 4 licenses on the building. So the first license is for our acute psychiatric hospital, which we call our admissions unit. And that is a 16-bed inpatient adult psychiatric facility for inpatient help.
Okay, that was transferred from the medical center hospital years ago?
Well, we've had the hospital for a number of years, and then took on probably a stronger caseload once the St. Joseph's at the time, once their inpatient unit closed down.
Ascension closed that about 4 years ago?
It's been a while. I'm not exactly sure on the number of years, but yeah, it's been a while.
Now, was that the AODA center also, or not? Do you provide AODA?
We do provide AODA. So the primary clientele that we see on the inpatient unit are individuals that have a mental illness and are in need of some stabilization. So they may be having experiencing a crisis at the current time. And so basically what we do is we work with our crisis line, and the patient in need or their loved one would get in contact with either the police or the crisis line, and then upon their assessment, they would determine whether or not that patient has a need for inpatient services. Upon that, they would go up to the medical hospital and get checked out and cleared for placement to us, just to make sure that we could meet their needs. And then on our facility, our admissions unit, we are staffed with a full-time psychiatrist, and that is, we also staff a psychiatrist 7 days a week. So no matter which day you come, our staffing's all the same. So we have a psychiatrist full-time. We also have a full-time psychologist, and then we have a team of master's prepared social workers. We have an occupational therapist and a great team of nurses and CNAs, mental health technicians, that all work together on helping to stabilize the patients.
Okay. Do you have patients who have withdrawal symptoms, I should say, from opiates or some other?
Yeah, absolutely. And what we refer to those are maybe individuals with a dual diagnosis, so that struggle with mental illness issues and also with a addiction of some sort, and maybe have struggled with that part of it and just need some professional help to get back on their feet. So it's a short-term unit. So typically our average length of stay is about 7 or 8 days. So again, it's not there to necessarily cure all their issues, but more to help stabilize them, to help get them a little bit better so they can return.
And from there, they would go into some other service, perhaps, and we'll talk about those other services. Now, you said you had 16 licensed beds.
Yes.
What does the occupancy run from day to day?
So we typically average between 10 and 12 patients a day.
Really?
We've seen as many as 600 admissions in a given year. So it's a very busy, fast-paced unit. We do contract with about 25 other counties, and in addition to taking Wood County patients.
Really?
And the reason for that is there are not a lot of county-owned and operated psychiatric hospitals anymore.
No.
I think there's less than 7 in the state now.
Wow.
And so they're pretty sporadic, the closest one to us being in Wausau. And so we do contract with a lot of other counties that are unable to provide their own resources for their county patients.
Legally, each county needs to take care of their own, correct?
Correct, or contract with the county that can.
Okay. Now, I assume that some of those clients that you have are probably on medical assistance.
Yeah.
So do you get the medical assistance rate, or does the counties that send someone pay you a different rate?
Sure. So with the 25 counties that we do contract with, we give them, so we have a county rate that we charge them, which is a little less than probably the state institution rate, like Winnebago and Mendota facility. So a little incentive, and plus it's closer to, especially when you're talking about some of the northern counties like Barron County, Chippewa County, that sort of thing. So it's a lot closer for them. And then what we do, because we all understand that counties are facing tough budget times, we do give the counties that we contract with a discounted rate, and so they do pay the same as our Medicaid rate or our medical assistance rate. Yep. And we also take Medicare, private insurance, private pay as well.
Sure. Well, this is interesting. That's something I wasn't aware of. That we send some of our incarcerated individuals that are in the courthouse to Wapaka, and Wapaka may be sending some of their mental health patients to us. So I wasn't aware of that.
Yeah.
Well,
Yeah. So
that's good. Regional cooperation is good.
Yeah, and we do partner with our local law enforcement agencies. A lot of times, the patients that we see come in on a detention, so they've requested the assistance of law enforcement and really didn't have a choice to come and get our services, but they've determined through their assessment that it would be beneficial if they did receive the services.
They still have some court-ordered detentions for the safety of the individual. when you would get some of those?
We have on occasion, but so there's a difference in some of the patients that maybe have been deemed not competent by reason of mental disease or defect. We wouldn't typically see those individuals.
Okay.
That's more of a forensics unit. But
Okay.
if they do have criminal proceedings that they're working on, certainly we do take those individuals, and when they are more stabilized, then we can release them back to law
Yeah.
enforcement.
Have you seen an upward trend in admissions because of the society changes? Or is it pretty much stable over the years? And you've been obviously at other institutions. So.
Yeah, I would say, it ebbs and flows just as any inpatient or healthcare facility. Certainly times of the year, our staff obviously sometimes think that maybe certain phases of the moon cause more admissions or
Okay.
not. But it's
Tax time.
Yeah, it's been pretty stable. I mentioned the 10 to 12 patients on an average daily basis. So.
Yeah, that's really interesting. Well, you have, outside of licensed hospital, we have other programs that we'd like to talk a little bit about.
Sure.
Let's talk about Bridgeway. What is Bridgeway?
Yeah, so Bridgeway, we've had Bridgeway for a couple years now, and what that is the name really does a good job describing some of it. It's really that bridge between the hospital or nursing home and the community. And so Bridgeway is an 8-bed licensed community-based residential facility.
CBRF.
CBRF, yep. And this is more of a crisis stabilization facility or a diversion unit. And so if individuals are out in the community and they don't quite meet the level of intensity to require an inpatient admission, oftentimes we certainly want to have patients in the least restrictive setting that they can be.
Sure.
And so they may be diverted and go to the Bridgeway unit, where we have crisis trained staff that work with the patients on a daily basis. It's a voluntary unit, so they're able to come and go as they please. And then it's also the crisis stabilization side of it. And so if we have patients that are in the hospital or nursing home that aren't quite ready to go back into the community, they can go there for a short period of time and really get the stabilization services
Sure.
that they need,
Okay.
and then be able to take that next step home.
Okay. What is the length of time that they can stay there? Can they be there for months?
Typically, it again is more of a shorter term unit.
Okay.
Typically, we see 1 to 2 weeks, sometimes shorter. Sometimes we've had patients there for 30 to 60 days. So
Okay. But it's not a residential facility.
not
like
for a
nursing
long
home.
term. Yeah, our goal at the facility, at least on those two units, the admissions unit and the Bridgeway unit, are really to help stabilize the patients and get them back into the community.
Awesome. All right, let's talk about Crossroads.
Yeah, so Crossroads is a very unique facility. There's not a whole lot of skilled nursing facilities like our Crossroads unit. So we are licensed as a skilled nursing facility, traditional nursing home, but it's primarily for individuals living with a chronic mental illness. And so those are severe and persistent mental illnesses that patients, the residents there, they have maybe had some experience on our hospital unit, gone back out into the community, and just don't have enough support out in the community to make it on their
Didn't
own.
make it.
And so this truly is a long-term care unit for those living with a chronic mental illness. But it's a locked unit, so that's pretty unique. So it's a very secure unit that we have there, as all of our units are.
Really?
Yeah.
I'm a little bit familiar with nursing homes. I don't think they can lock their doors.
It depends. You need to jump through a lot of hoops and all that. Typically, what you see in most nursing homes have a delayed egress, where if you push on the door long enough, you can get out. So it's not truly a locked unit, but this is truly a locked unit where you need
Because
an
you
actual
have-
key.
Okay, you're authorized
Yep.
to keep people inside, which is why when you drive by, you really don't see too many people walking outside that are not staff.
Yeah, and actually, that's kind of changed over the last couple of years since, as Brandon mentioned, we've kind of changed to the Wood County Annex and Health Center. So we do have a lot more, I think the stigma with Norwood has always been it might be a scary place or a place where you don't want to go visit. And that couldn't be further from what we do. We take our residents outside, we garden with them, we take them on walks. So it truly is more, we're trying to get as home-like as possible for these residents to come outside.
Isn't that interesting? Because way back in the early 1900s, Norwood was a farm.
Yep.
It was actually called an asylum.
Yep.
And and the residents grew their own food. And I guess they even had dairy. We're going to do a story on that later. I'm trying to get a hold of some people that
I can put you in contact with a great resource for that because we actually just at our last all staff meeting we gave a shortened history of Norwood, and it's just incredible.
That is okay. Tom, mark that down. We're going to do a program because it's extremely interesting how the concept of caring for people with mental illness has changed, all for the better, obviously. But I can remember growing up where there were folks that we knew, aunts or uncles or somebody who was, out at the farm. And,
it used to be work therapy up until about the 1950s, and that's when that was kind of proven not to work that well, and so they've gone more to the talk therapy that we see today.
I don't recall ever. I don't know if we had family out there, if there was somebody that I knew that had family there, but we never visited it. But I knew it was there.
Well, we have all the records, so.
I knew it was, don't look them up. The services that you offer specifically, so they just don't sit around watching TV, eating candy bars, what do they do?
Yeah, so and that's something that being regulated the same as traditional skilled nursing facilities, we have to follow the same rules and regulations, and that's really trying to provide more of a home-like atmosphere, and so they aren't sitting around just watching TV all day. So we do have a very intense activities program that really focuses on more activities for individuals with mental health issues, things that are more therapeutic, such as arts and crafts. And, typically when I think of nursing home activities, you think of bingo or the bird aviaries or whatever, and this is we make jewelry, painting groups, music therapy has been a big enhancement to our programs. Exercise, we do have a good partnership with the Y being located right next to us, and it's kind of a dual partnership. We have 21 acres of beautiful land out there, and with all of the construction and everything going on, we've allowed the kids of the YMCA to come and use our grounds for athletic fields.
Soccer, kickball.
The residents enjoy watching it, and it's just nice to see.
Oh, that's wonderful. Move on to a really interesting program that actually when I was on the board at Norwood, I was familiar with the process, and we'll start out with Brandon. It's called Bridgeway. And what was the genesis of Bridgeway? What is it? And then you can talk about it also.
I think you're talking about pathways.
I'm sorry, that is what I
Yes.
say. I got to turn the page here. Thank you.
So the Pathways unit was our traumatic brain injury unit that was housed at Norwood Health Center.
Pathways.
Yeah, and so we had that program for a number of years and began the process of transitioning that to Edgewater Haven Nursing Home, which is what our plan is, hopefully in the next couple months, to get that unit opened up at Edgewater Haven. Okay. But we transitioned that unit from a TBI unit to another long-term care unit.
Okay. The program is a fairly unique program statewide because not many facilities can offer that. Is that correct? And the state approached Wood County back several years ago to offer the service. It's a state program more than a county program.
No, it's a county program, and I'm not familiar with the history on when or how it came about.
Okay.
That predates me, but
Okay.
it sounds about right because there really is a need for traumatic brain injury services. Correct me if I'm wrong, Jordan, but I think when we open up Edgewater Haven, we'll be the second TBI unit operating in the state. So
Yes.
there had been one in Milwaukee that recently closed.
Right.
And there's a large facility that's in Juneau, Wisconsin, in Dodge County
Right.
that operates.
Yes.
So
Yes, and I guess I have more history on this because of my earlier
Yeah.
involvement than you. But the problem was there was nothing of that kind of service available north,
Yeah.
up north, and there are family members who need to and should be able to visit their TBI, their traumatic brain injury family members, and have to drive to Milwaukee or to what was the other site, Juneau?
yeah, Dodge County, yeah. So
Dodge
Juneau,
County.
Wisconsin.
That's a long drive. If you're from
Mhm.
Ashland or from, Superior,
Mhm.
you can't get down. And obviously,
No.
if your loved one has had a bad accident
Mhm.
and ends up for long term. So I believe the clients are there for some period of time, are they not?
Yeah, so typically the brain injury clients have been there. Typically, we see about 90 to 100 days. They can stay up to 1 year, usually. And so it is a very unique program. I've overseen that program for several years now, and some of the most incredible outcomes that I've ever seen in my
Really?
career when you're talking with individuals. Oftentimes, I call them the young and questionable decision-making population, my age group, and young males. Oftentimes, we see accidents. And it really is unfortunate, but to see their progress and how they progress through therapy is just incredible to be able to get them walking and talking and back
So
home.
what type of services specifically do you provide?
Yeah, so currently, as Brandon mentioned, we had an opportunity to, when you think about going and getting rehab for your loved one, you don't necessarily think of a mental health facility. And so we identified an opportunity with the available space we had at our other county nursing home. And two, the other traumatic brain injury units throughout the state were really housed out of rehab facilities. There would be a good opportunity to move that program down there. So what we do is we provide speech, occupational, and physical therapy. They get between 2 and 3 hours of therapy per day, usually 5 days a week. They also have neuropsychiatrists that are available and work with the patients as well.
Now, do you have staff at one unit at Norwood that would work in another unit?
Yeah.
Like occupational or physical therapy, or there's some,
Yeah, so that's a little different because again, I mentioned our Crossroads unit. The long term really didn't see a lot of therapy needs at that point when you talk about physical, speech, or occupational.
Sure.
And so typically, those therapists were specifically trained to work on the traumatic brain injury residents. At the facility. And so now down at Edgewater Haven, they will be able to work with both the traditional rehab residents and also the traumatic brain injury unit.
Now, is Edgewater under your direction, or is it under Human Services? That's a separate business, if you will?
Well, actually, for the time being right now, Jordan is the interim administrator at Edgewater Haven.
Okay.
So Edgewater does fall under the Human Services Department, but you need to have a licensed nursing home administrator that licenses the building. So Jordan is handling both duties at Norwood and Edgewater Haven right now.
Right. Edgewater is one of the few remaining county-owned nursing homes. And it's been some discussion about the need for the county to be in a business that other businesses are in, competition-wise and so forth. But I noticed that more and more of the private nursing homes are in fact closing.
Yeah.
Does that mean that Edgewater is becoming a real necessity? Are they getting clients that were previously at closed nursing homes?
Yeah, and I think that's a great question to ask. And yeah, we are getting referrals because of the change in the nursing home industry and closing.
Right.
But the nursing home industry as a whole has changed a lot over the last number of years. Particularly if you look at the southern part of the county, there's a lot of assisted living homes. So we're seeing folks that used to be traditional nursing home patients that are now in assisted living patients.
Sure.
So all the residents that we're getting, I shouldn't say all, but a number of them are harder to serve or have more needs than they did, say, 20 years ago.
Yeah.
But is there a definite need? Yes, there's a definite need for a skilled nursing facility, in a county-owned skilled nursing facility.
Yeah. I think that's a situation that's probably going to get worse in general than better because of the aging population.
And there's a struggle with reimbursement, and that's a big struggle that you'd mentioned when we were
Right.
talking.
Yeah.
And the Medicaid rates being so
Right.
low for nursing homes,
Yeah.
it's a struggle when you're getting more and more of those residents.
Absolutely, and that's a shame.
Mhm.
I mean, right now the state has a budget surplus and they don't know what to do with it because some group wants to do this. How about human service reimbursement so that they can take care of the people who raised the families and put their kids through school and now they're in a nursing home and they can't afford it because there's fewer nursing homes to go.
Yeah.
There's a whole issue. Some other time it's we won't get into politics
Yeah.
of it, but that is an issue.
It is.
Human services versus highways.
Mm-hmm.
And we need both. But
Yeah, we do.
anyway, I thank both of you for coming up here to Marshfield and visiting with us and telling the community a little bit more about what's going on at the Norwood Health Center. And we're going to keep Brendan here in another short program, hopefully, so he can get to work about the larger scope of human services for Wood County. So thank you both for coming.
Thank you, Dan.
It's been a pleasure to have you up here.
Appreciate it.
Thanks.